a wonderful idea.
Why is that?
Because as a non-smoker, it's not nice to have to sit in a patio and enjoy a summer beer with a lung full of smoke.
Yeah.
Well, because I think smoking in general is just not healthy for anyone, and to be exposed to it is anywhere is not a good thing.
I think it's a great thing. I'm a non-smoker, so I'm not in favor of smoking anywhere, really.
Some people thought about the city's new smoking bylaw. Are you getting much feedback on it now that it's been in place since April 1st? I know the fines won't start until July the 1st, but have you heard much about it? Has it had much of an impact? I know for the most part in April we haven't had the kind of weather where people would be spending a lot of time on the beach or on the patio, but has there been much response?
I haven't heard a lot of feedback post-decision. I've been out in my ward and I see that a number of businesses are putting up signs advising residents of the new bylaw. So it's great to see that the business community is helping us in terms of getting the message out there. This is an issue where I think we did extensive consultation citywide. We spent a great deal of time talking to as many residents as we could. And at the end of the day, I really heard, as you saw from your little survey, I heard from a lot more residents who were supportive of the restrictions that we have in place for the very reasons of the dangers of secondhand smoke and the desire to have smoke-free parks. So I haven't heard a lot in the wake of that decision, other than to see that the businesses look like they're working with us.
Is this really about the dangers of secondhand smoke, though, or is it more about a public health agenda to make it harder and harder for people to smoke, because then they'd be less likely to do so and won't incur the harm that smokers get, firsthand smoke?
Well, I mean, I don't sit on the Board of Health, obviously, but you know, I think it's a bit from column A and a bit from column B. I think we have to remember that you know, obviously protecting folks from, they go hand in glove, protecting folks from the dangers of smoke, whether you're willfully inhaling it or you're, you know, passively inhaling it. I mean, the reality is 1,000 people in Ottawa every year die as a result of smoking or tobacco-related illness, and that 1,000, not all of them are smokers. So, you know, at the end of the day, when the Grim Reaper comes knocking, you know, whether you're a smoker or a non-smoker, we want to be able to protect you. And I think that's probably you know, one of the key drivers of this law.
Do you think there will be much feedback when the patios are open, the beaches are open, the parks are more populated?
Okay, well, as the councillor for at least a part of my ward, being Bell's Corners, which is the only place in Ottawa with organizations who came out officially opposed to the restrictions, our Legion and our BIA.
Yeah.
You know, I think there are going to be some objectors because people are going to start to, well, I've started to hear it already. There's no place left to smoke. Pretty soon there'll be no place left to smoke. But I think you're right on column B, as you were saying. It is part of the continuum that is supposed to lead to a situation where it's very difficult to smoke, and that's supposed to help people to stop smoking.
Should the Legions be exempt? Some people have suggested that just because of the service that these people provided to their country.
And then the opposing argument is the majority of members of the Legion are non-smokers, and just like the majority of
Sure.
members of the public are non-smokers. And so if you have a Legion where almost everybody there is smoking, that probably indicates that you're shutting out people who are non-smokers. So I don't see how you exempt the Legion and not exempt hospital patients and not exempt, you know, a whole raft of other individuals.